some information, history, basic background, basic descriptions of things. And then Andrew will be talking about herbs, Chinese herbal medicine. So maybe we can have a break in between. So if there's any questions about what I talked about, because I will probably cover it, but if I don't, then we can get to that. And then once Andrew's done talking, I'm going to talk a little bit more about some more information. So does that sound good with everybody? Okay. All right. Awesome. So forgive me for sitting. I'm still recovering from an injury, so sitting is just easier. Also, this is kind of nice, pretty informal. And also forgive me for having notes in front of me, but there's a lot of information that I'd like to get through without stammering and stuttering and things like that. So real quick to get started, thank you all for being here. We are acupuncturists and practitioners of traditional Chinese medicine, and we love what we do. We love being able to share it with people. Getting into talking about it, we really need to start with a little bit of background history. So one of the wonderful things about Chinese medicine, one of the things that I love about it, is how old it is. So it originated in China, as well as we know. Those are the oldest documents that we have, and the oldest archaeological evidence that we have indicates that it started in China. But it's been influenced by Indian medicine, Middle Eastern medicine, Tibetan medicine, as well as other theoretical traditions like Confucianism, Buddhism, but mainly Taoism. So if you think about the history of China and the Silk Road route, there was a lot of information going back and forth all the way to Western Europe. So one of the earliest texts and most important texts that we have in Chinese medicine that we base, it's the foundation of our medicine, dates back to over 2,200 years ago, but it's said to be written by Wang Di, the Yellow Emperor, the Great Yellow Emperor, who dates back to around 2600 BC. So it has spread all over the world, and there's many different lineages and ways to practice acupuncture. So if you see an acupuncturist and they're doing things a certain way, and they say, I practice this type of acupuncture, you can see someone who practices all different types of acupuncture. We practice Master Dong style acupuncture, which I'll get into describing later. So let's see, Chinese history is a written history. So we have about 3,000 years of clinical data in traditional Chinese medicine. So that's one of the great benefits of this medicine, is that we have all this written documentation to go back to, all this clinical data. And the thing about being such an old system of medicine is that it's had at least 3,000 years of development, right? So it's not a good medicine because it's old. It's good because it's so old that it's had time to develop over the millennium. So let's see. And though its foundations are in China and Chinese medicine, it is now all over the world and everyone's using it. It's used for any person. It's even being used for animals now. So that's great. And it's actually quite effective. It's more effective in animals than in people sometimes. Now, what is acupuncture? So acupuncture is the insertion of filiform needles, sterile filiform needles, meaning that they're not hollow. So they're just, what is the metal? I'm thinking surgical steel. So it's just a surgical steel hair-like needle that I'll show you later. And they are placed into certain points on the body to harmonize the internal imbalance and reestablish homeostasis. So these points in the body are called acupuncture points, and they generally run along 12 main meridians throughout the body. The meridians, which are also called channels, are pathways that run throughout the entire body. Thus, we can treat one part of the body by using another because of these connections. We can treat the internal organs based on the relationships with the channels and those organs. We can treat them also via the relationships and characteristics between the different channel systems. So the acupuncture points have specific names and functions, but you can think of them as locks within a channel. So when you're putting in the needle, it's like you're turning a key and you're directing flow of the qi, which is also, some people will call it energy, but really it's described more as a vital substance in Chinese medicine. And that acupuncture is going to move the qi. So that's always the mechanism behind acupuncture is movement. So we're trying to get things to move within these channels in the body. Traditional Chinese medicine theory states that acupuncture works by influencing qi in the body. And Western science has proven that acupuncture can influence many mechanisms in the body, including the endocrine, nervous system, and immune system. So some people call it an energetic medicine. I would not call it an energetic medicine. Most acupuncturists don't. Even though we say we're working with qi, we're using a physiological response, right? So we're putting in a needle and that's having a physiological response in the body. It's causing a micro-inflammatory response in an area. We can measure that, we can see that. It's not like we're putting a hand over someone and trying to move it insubstantially. So that's what I have to say about it being an energetic medicine. For the most part, acupuncture is painless and relaxing. And the most common side effect of acupuncture is a sense of relaxation for most people. Another thing about traditional Chinese medicine is that the treatment is based on pattern diagnosis. So it's about treating the person and seeing the person as a whole system rather than symptoms. So instead of going directly at the symptoms, it's looking at you as a whole system and how that is causing those symptoms and manifesting in those symptoms. So there's a maxim in Chinese medicine that says 1,000 diseases, one root, one disease, 1,000 roots. So we can break that down as 1,000 diseases. So 1,000 symptoms can have one cause, right? Like one imbalance internally. But one disease can have 1,000 different reasons for it. Does that make sense? So what we're looking for is balance between the systems, the internal systems, and the pattern diagnosis is a statement about how the systems are interacting in an imbalanced way to give your symptoms. So meaning if someone comes in with a headache, we're going to find out by looking at the whole, the whole person, all of their systems, what we think is causing those headaches in that person. Another person can come in with a headache and have a whole nother different reason for why, a pattern diagnosis of why those symptoms of headaches are showing up. Meanwhile, someone could come in, have the same type of pattern diagnosis, that same kind of imbalance, internal imbalance, but it's manifesting as different symptoms for that person. So every person is different, and the way that we would treat every person would be different, and it can be different with each time of treatment, depending on how that person is presenting. So it's a very dynamic, very creative, for us, a very exciting way of treating because, you could do things 1,000 different ways, and we have all these different points and channels to work with, and we can be very creative in doing this. So whenever you're working with an acupuncturist, and let's say that they're using a point that you don't really care for, you can always ask for something else, and they should be able to facilitate in some way, but I can't speak for every acupuncturist. So the broader picture of this idea of pattern diagnosis is that we don't have to have a specific biomedical diagnosis or identification of a specific pathogen. So we can work with what the subjective information that a person gives us, what we're seeing in their physical presentation, the observations that we're making, and then that is how we would be treating. Whereas, labs are great, diagnostics are great, imaging is all fabulous, but if we don't have that, or it's inconclusive, which is happening most of the time with the people that we see, we can still treat. So an example of this, the current example of this is the pandemic, right? So historically, there's many texts about in Chinese medicine how a new pandemic would arise, an endemic. And then they would, by using the pattern diagnosis, the way that they treat, they could treat anything that arose without having a previous experience in treating that disease. Does that make sense? Okay. So what we've been working with now is some of the patients with COVID, the long haulers, the people who still have, are still suffering from the effects of COVID. And we're able to help them and have good effects with treatment because of the way that this medicine is organized. So another great thing about acupuncture is that it works really well in conjunction with Western medicine. So even if you are really attached to Western medicine, we're not saying like, oh, you have to do one or the other. It goes really well together, and it doesn't contraindicate with medications. In fact, it's used very often to help with the adverse side effects of medications. So great example of that is chemotherapy. So people dealing with chemotherapy and the devastating effects it can have on the body, acupuncture can help alleviate those effects, and then people can attain the therapeutic dose of chemo that is needed. So what is acupuncture used for? So it is most often thought of as a way to treat pain. That's what most people think of for acupuncture. That's what most insurance only covers it for. However, it is used to treat gastrointestinal disorders, respiratory issues, genitourinary complaints, hormonal imbalance, menstrual and menopausal issues, infertility, fatigue, insomnia, and psychological issues such as anxiety and depression. We are working a lot with people coming in with anxiety and depression these days because of the pandemic. So we see people for all of these reasons and more that I haven't listed. But so often we are seeing people who have had acupuncture before and choose a more holistic lifestyle approach. And that's great. But often we are seeing people, most often we're seeing people who have never had acupuncture before, never thought they'd have acupuncture in their life, but are dealing with an issue that they can no longer, they've reached a dead end. So they've tried every other avenue and we're kind of their last hope. So that happens quite often. And it's great, but we would love it if people started coming in earlier and then we're not dealing with all of the surgeries that have happened before then, or then all of the medications that have happened before then. So the more that people can learn about acupuncture as a venue to something to check out, then the sooner maybe we can help them before we are the last resort. So sometimes people will come in with a symptom that doctors don't know how to treat, or they don't know how to measure. Labs and diagnostics don't show what it is. And they're told that it's all in their head. But often in Chinese medicine, there is a name for it. There's a term for it. And people will feel validated in that, oh, the thing, and heard in that the thing that they've been trying to fix for a while and that no one will really admit is a real issue, in Chinese medicine, there is a term for it and there is a way to treat it. So that is really great for patients. Let's see, what brought me to Chinese medicine? I had issues with, am I going too fast? What do we think? Sorry, I'm trying to get all of this information in. So I was brought to Chinese medicine because I had issues with my menstrual cycle. And I was told, I think at the time I was 15 or 16. And they just said, okay, well, you can just have birth control and then that's it. And that was really, that's still mostly what they can do. And I was on birth control for 7 years. And I just thought one day, like, I don't want this to be the rest of my life, to be on medication for the rest of my life. And so I got off of the birth control and my cycle was very messed up for a while and very painful. And then it just stopped. So I ended up seeing a acupuncturist, and she fixed it. She brought things back into balance using acupuncture and herbs. And it was in a few months time. So that's the other thing about acupuncture, which I should have mentioned. Usually it's not a one and done treatment. So it usually, especially with some chronic conditions, longstanding conditions, it takes a few treatments, sometimes several treatments, sometimes a few months of treatment. So this took me a few months of treatments to fix my menstrual cycle, but then it was fixed. And it wasn't like, oh, you have to keep doing this for the rest of your life. You have to keep taking this pill for the rest of your life. It was just taken care of, and I could move on with my life. So that got me thinking about Chinese medicine as something to look into, because I knew I wanted to get into medicine at some point, and I wasn't sure which form. So that kind of solidified that more for me. Another interesting thing that I like about Chinese medicine is that reading about the healers so my mom's Peruvian, and hearing about the healers of the Incas, the emperors, was this group of people called the Quero, and they were known as the seers. And they told this anthropologist about these rios de luz, these rivers of light in the body. And he said, draw it for me. And so he drew them on him, and they looked just like the Chinese meridians. So this is another medical system in another part of the country. And it made me think about like how it's not just something that pertains just to Chinese culture. It's not just like a lens view. It's something material. It's something that multiple groups can access. So that also had me thinking more about Chinese medicine, going into Chinese medicine. Did you want to talk at all about what brought you to Chinese medicine?
Sure. Yeah. Really quickly, it was just, I had been working as a massage therapist for a while. I was pre-med before that, so I already had an interest in medicine. For me, I kept on running over a point in the leg, and every time I would massage this point in the leg in a specific way, the person's stomach would grumble. And it was super weird. And we always chatted about it like, oh, okay, your stomach's going to grumble. I don't know why, but... Do
you want my earpiece?
But here we go. No, it's okay. I think. And I talked to doctors about it. And they had no idea. They thought it was just weird. But an acupuncturist who I worked with at the time said, oh, no, that's a point on the stomach channel. We use that to move the stomach and facilitate movement of the stomach in case of like gastroparesis or things like that. And it just blew my mind open. I was like, it's not only a system which can explain these weird things that can happen, but it explains it predictably and therefore can be used. So I was like, it just made me kind of super excited very, very quickly. So yeah, when I stopped the career that I was in at the time, I went back to 4 years of med school, and here we are.
Very cool. Thanks, honey. Okay. Got that. There's that. All right. So now, does anyone have any questions before moving forward? No? Okay, yeah.
If someone goes in and gets treated for the first time, like the next day, will they feel some sort of instant relief?
Most likely, yeah. So not even the next day, it could be instantaneous.
How long would that feeling last?
It depends. It depends what we're working on. That's a really good question. So if someone has like pain, you can notice a difference usually instantly for pain syndromes. But for other issues, like let's say, for example, if I'm talking about working on someone's menstrual cycle or, something like that, they're not going to know until they have their period again. So that will take more time. But if we're talking about digestion, someone could come in feeling really bloated and painful or nauseous, and they can notice the difference right away as soon as the needles go in. So that being said, there are some cases where they might not feel it right away, but that's rarer. So, well, that's also why we use other modalities. So that's also why we incorporate massage, so body work, cupping, and Gua Sha into our sessions, as well as moxibustion, so that the person is will see as much a difference as possible the soonest. But that's a really good question. Did I answer that okay? All right.
What you're in there for.
It does depend what you're in there for. It depends how long it's been going on for. So someone who just sprained their ankle yesterday, they come in, they're going to notice a difference faster, and it'll resolve faster. Might even just take one treatment. Whereas someone who's had an issue for 40, 50 years and coming in, that might take longer to chip away at. But that being said, the severity of the sprain will also tell us how long it's going to take. Minor severity, not going to take too long. They'll notice really faster, but more severe, might take longer. Typically will take longer. Does that make sense?
Yeah.
Okay.
Always in the same spots they put the needle?
No. Yeah. It depends how the patient is presenting. So sometimes, let's say the person has decreased mobility and you can't use a certain part of their body, you can use other parts. Typically, the way that we work, so when I was talking about that we practice Master Dung style, it's a type of style where we rarely do local needling. So let's say someone comes in with a hurt shoulder, I'm going to be using points on the opposite leg to affect that shoulder. And then they can move that area around and see, does it feel better, worse, the same? Then after that, we might put a needle or two, or even in the hand, to kind of channel that intention, or I should say channel the chi through those areas, through those specific channels that we're using. And then we would incorporate massage or cupping or Gua Sha, the scraping technique, as well, to address the tissue directly. So you get the acupuncture and direct tissue work, depending on, what it is that you're coming in for. Does that kind of make sense? Okay. So, and, that being said, it'll be different for different people. If sometimes I have people who are really like, I really want a needle here because this is where it hurts, and this is where I got it before. And so, yeah, of course, I can help with that. I can put a needle there, no problem. But it's not typically the way that we work. And typically people prefer not to have a needle put in the place where they're experiencing the most pain. So, any other questions?
Can you say the needles are moving the chi or the energy?
Yeah.
So is it the basic premise that if you have a blockage, that's the basic?
Yes, exactly. There's a blockage, or there's a deficiency, or there's an excess, right? The blockage is an excess, right? So let's say, usually when you have a blockage, you're going to have pain. So by moving the chi in those channels in that area, so that's the other thing, is that, if someone comes in and they're like, okay, I have a rotator cuff tear, nobody ever knows what muscle it is that they have the tear in, because they've been told rotator cuff, but there are 6 different muscles that make up the rotator cuff. So they don't know which one. So we can assess by where is the pain, with what movement, with pressure, and then use the channels that correspond to those areas and the image correspondences in another part of the body to address it. So, and then that will move it through. And then we do what we would call anchor points to anchor it through those specific channels even more. Does that make sense? Okay, great.
Do you work with a lot of chronic arthritis?
Oh yeah, definitely. So that's the thing about when we have any kind of structural issue like arthritis, right? It's not going to make the cartilage grow back. It's same thing with like herniations. We're not going to make the disc move back into place. But what we're doing is we're managing the pain of that. We're managing the inflammation in the area with acupuncture. So it's very helpful for that. my father tore his medial meniscus many years ago. And, you know, it was when I was still in acupuncture school, and he was like, well, I don't see how it's going to work. And, you know, like PT didn't work. And they were saying that he might need surgery. And I said, just give it a chance. It's not going to make the meniscus, that cartilage, repair, but it's going to help with the inflammation and the pain. And he went for treatments for 2 months, and he was with a cane, a brace, and painkillers, and still hobbling around and limping. And after 2 months of treatment, he was able to walk normal, and he's been fine since. So sometimes I'll treat him, you know, maybe once every few months if I get the chance to, but he's still fine. Like, it doesn't bother him anymore. The meniscus itself didn't repair, but the pain syndrome did. So, you know, that's definitely for arthritis. Sorry, that was my long-winded way of saying yes.
A lot of what we find too is that there'll be a name attached, like a Western medical name attached to your pain, right? So I have hand pain. I go in, they do a scan, they find inflammation there. So there's arthritis that you can see, right? So then the pain becomes attached to the arthritis. But we see time and time again that we can get rid of the pain, and the arthritic joint might still be there, right? So the pain and the name attached aren't always as associated as we think that they are. Not only that, so arthritis is a great example. We take the pain away, you can move the joints freely, that increases circulation, which reduces inflammation. And then you don't have arthritis, because arthritis is inflammation in the joint. So very often what we're trying to do is help the body heal itself, or put the body in a position where it can heal itself. Because that's when, with all of the power of your body on your side, that's when really radical change can happen very quickly.
No, that was great. I love it. Thank you.
If you want to summarize that, someone said that they can't hear Andrew.
Oh.
They could hear the questions, but they couldn't hear Andrew.
They just don't my mask.
So basically, he was saying that there's this association between the diagnosis, right, of arthritis and the pain. But through acupuncture, we can get the pain to go away, even if there is still technically arthritis in the joint. So the two are not, like, they don't have to exist together. And what else did you say?
Arthritis, movement, circulation.
Yeah, so it's increasing the circulation and movement in an area. So so I was totally listening. I was there 100%. And I was like, oh, he's so smart. He's so brilliant. And then now I'm on the spot. So what he was saying is, by decreasing the pain, you can then start to move. When you start to move, you're increasing circulation and mobility in an area, which is then in effect going to further help decrease pain and inflammation in an area. It's kind of like a feedback loop that you create in that. So that's what he was saying, very eloquently, very well, and very brilliantly. Yeah, thank you, honey. Sorry about that.
You ever use those acupuncture, like I say, with like methods, like gloves? I've seen some people come to my session. Do you have them?
Oh, the magnets. These things? Yeah. These are magnets. So this is for acupressure on a point, which I'm going to get to talking about these and the ear seeds, which do similar things. And it's just a way to continue the stimulation of the point. So even if the needle's not there, we can put in these magnets to continue the treatment to make it last longer. So when you see that, it's because they're on a particular acupuncture point and you want that to last longer. And so you put the magnet on it. Does that make sense? To have it carry on more? Okay. So how are we doing time-wise?
It is 3:33.
So how long have I been talking for? About a half an hour. Okay. So I'm going to go over this stuff super quick so we can get Andrew to talk about herbs. This is called the myths and misunderstandings. So if we talk about licensure versus certification. So if you're going to see a licensed acupuncturist, they have gone to an accredited acupuncture college, and it's been about 3 to 4 years of training. Our program was 6 years that they smushed into 4 years. So the most unhealthy time of my life was in medical school. In certification, so if someone is a certified acupuncturist, that's usually a chiropractor who does acupuncture, a PT who does acupuncture, an MD who does acupuncture. It's a certification. I think they range from 200 to 400 hours, something like that. Couple weekends worth of training. So very different. They tend to do more dry needling. So I'm sure people here have heard of dry needling, maybe have even had dry needling before. And that's when they're sticking the needle in the place where it's really hurting. Typically, it's a trigger point, which is a neuromuscular dysfunction where it's like this point of hypersensitivity that can sometimes send pain traveling to other parts of the body. So trigger point is great, and they can get it to release that way. And lots of patients have come in and said, my PT did it for me and it was great and I got my pain. That's wonderful. That is not based on entirely, and that doesn't encompass traditional Chinese medicine or medical theory. So typically they're not working with the channels. They're not working to balance the internal system. So that's the difference between those two things. There is NADA protocol, which is a detox protocol. They are taught auricular acupuncture. So that's based on the premise that the ear is a microcosmic representation of the entire body. So it has all the systems and parts of the body in the ear. And you can access that with the needles or the ear seeds that I'll show you later. So those are not always licensed acupuncturists, but they've had the training for NADA protocol. Very important because lots of different groups need access to detox from drugs and substance abuse. Let's see, is acupuncture and traditional Chinese medicine or classical Chinese medicine the main medicine in China? It is very common. People will do a lot of things for themselves at home. So they'll moxa themselves, or they'll Gua Sha themselves, or cup their children. So it's all the medicine that they can do at home, they do, but also it's used in hospitals in China. Sometimes you go to a hospital and they'll have both, biomedicine as well as traditional Chinese medicine, acupuncture, herbs, things like that. But sometimes you can go to a hospital that'll just have one or just have the other. But it is it's all throughout China. So people eat and live their lives based on principles in Chinese medicine. It's just part of, how they grew up. Let's see. And I'm making huge gross statements for an entire country of people, but that's the overall arc, is that they grew up more with an understanding of this medicine and what foods to eat when, and certain practices to have, definitely more than Americans have in any way. Let's see. So acupuncture points, are they the same as acupressure points? Yes, they're just one you're pressing on with your fingers and one you're putting a needle in it. Same thing. Not all acupuncture points though get a needle. So there's one in the umbilicus. You don't needle. You would moxa, and we'll talk about moxa later. It's a heating therapy, so you apply heat to the area. So that's just an example of that. Last thing, Chinese medicine is medicine. So when people come in and they say well, I was trying, real medicine, and then I thought I'd try this. So this is a medical system. It's a Chinese medical system, and the terminology is different. The theory behind it is different, but it is evidence-based, and we do have a lot of clinical data. It doesn't follow the same parameters of Western medicine, and, you know, based in, I would say, you know, bias in this country, and, you know, ignorance of another medical system, that we're not exposed to it. So to us, it's kind of like, oh, it's not real. So, but it is a medical system in and of itself. That I'll just say, but it works really well with Western medicine also.
Good question.
Yeah.
The pressure point that you can't put a needle into,
Mm-hmm.
is there why?
I think it would be extremely painful. Also, the tissue is already coming down into the abdomen. So it could cause issues with that area. I don't know what else. What would be the other reason?
The location of it just is not ideal.
Yeah, I mean, there's a point on the nipple that you wouldn't needle either. So I think it's just that it's too painful or too uncomfortable. The tissue is different. Yeah, because you also don't needle in the eyeball. So it's like certain tissues you're not going to needle in.
The basics of it too, or one of the ways that acupuncture points developed are what are safe places you can use to treat on the body. If it's not a safe place to use, it's kind of like, oh, this is an influential area. It can make change, but it's not safe to use, so we don't use it. There are substances in herbal medicine that, you know, they can create significant change in the body, but we don't use them because they're also poisons. Same.
All right, excellent. So, honey, do you want to talk herbs?
Yeah, sure.
All right.
Do you want to give them the
Yeah.
right?
Sorry for that static. Is that working? Can people hear me?
I'm not seeing anything pop up, so
No?
I'll say go ahead.
Awesome. Okay. Little moment O interaction. I'll just be very brief with Chinese herbal medicine. When you talk about Chinese medicine in China, you're talking about Chinese herbal medicine. There's two distinct traditions, an acupuncture-based, channel-based medicine, and a Chinese herbal medicine-based tradition. They're not the same thing. We use them both, we're trained in both, and we talked about them kind of as if they're the same thing. It's a part of the same overarching philosophy and of medicine, but they're different medicines, right? So, so Chinese herbal medicine is the longest, most widely used, continually used medicine in the world, bar none. Again, we have 2,000 years of medical data, and not just like, you know, fluffy, I did this and it worked really good, but like the patient came in with these symptoms, I did this was the result over time, very specific clinical data. So it's wild to be treating somebody here, have them come in and talk in exactly the same way that a patient did 2,000 years ago, and not know that there's that relationship. And to hear somebody's story now, and then having read literally that person's story 2,000 years ago, it's pretty wild. So lots of fun. The way that traditional Chinese medicine is traditionally used is in its raw state. Basically, you have these herbs, mostly herbs. There are a couple animal products. We don't use those here generally. And if we ever were to, we would specifically say this is also an animal product. But almost everything is either a herb or a mineral. And I would say 98% of the substances we use are herbs, and maybe 2% are minerals. And a formula will look like, big drum roll. Thank you. Will look like this. So in Western herbology, very often it's one herb, right? So I take chasteberry for menstrual issues, or I take peppermint if I have a sour stomach. In Chinese medicine, it's always based on formula. So it's always, with the exception of one formula, multiple herbs. The teeny tiny formulas, we call them, are 2 herbs, and then it can go up to 20 or 30 ingredients. There's a couple of chief kind of herbs or substances that are getting the main action. And then all of the other herbs are helping to reduce side effects, helping to bolster that main action, helping to direct the action of that formula towards a specific area. We can really get granular with what we want to do. So for instance, patient A comes in, headache, specific pattern, like Marielle talked about, pattern diagnosis. So we're treating the pattern, not the headache. And you know, they're of this specific constitution. So we give them formula A, right? Second person comes in, same headache, same pattern. We would give them the same formula, but then we'd also want to look at them and say, what else does this, else does this person differ? What do we need to add? What do we need to change? Maybe we need to make it a little bit more cooling because this person runs really hot. Maybe we need to make it a little bit more sweet because that person has a tendency towards like a wiry sinews, things like that. So we can, on an individual herb basis, really adjust what we're doing for each person. So I'll bring this around and you can just take a smell, take a look. You can actually pass it around yourself. Tell me if you, yeah, you can play with it. I would not recommend putting it in your mouth. I know, right? That was, when I see it, that's my first one. But give it a good smell. Tell me what it smells like. It smells like nothing. No. Yeah. Is it a smell you recognize? Can you hit the water boiler? Yeah. Oh yeah. Thank you so much for your sponsorship. Great to meet you. Excellent. There you go. Yeah, good nose. It's not something you hear very often, right? Good nose. Very close, yeah. Yeah. There you go. Got it in one. Nice job.
Here we go.
Is it boiling? Cool. So yeah, I'm going to take you through the whole thing. That's the highly specific therapeutic dose. This is done very specifically if I'm actually going to prescribe it to somebody, but I'll just take you through the... Sorry? Yeah, exactly. A little bit of this, a little bit of that. No, it's done per the gram. So it's not only... So this is the most common, most famous, most important herbal formula in all of Chinese medicine. There are something like 200 formulas that are based just on this one, called Guizhi. And good job, Guizhi is cinnamon stick. So it's a very high quality cinnamon, but basically it's just cinnamon. And so what you did when you were smelling it was your highly tuned nose, right? And if you were tasting it, your taste buds, what they're picking up on is a chemical in the constituent, in the ingredient, right? So basically your the sense of it, the taste of it, or whatever, is a way that your body can tell what that action will be. So a different way of saying that is all of the herbs are classified by taste. And when we say taste, what we're talking about is action. So for instance, you smell cinnamon, it kind of gives you that feel, like a little bit opens up like your eye a little bit. It's a little bit pungent, very kind of like, you want to take a deep breath of it, right? Like if you smell cinnamon, you want to huff it. It's like, cinnamon, right? That's very close to what the action of the herb is. It opens up the orifices, it raises things up a little bit. It does a whole bunch of other stuff. But so very often it's used for, one of the main classical indications for this formula is for things that we might call cold, right? Because what it's going to do is it's going to bring all of your energy to the surface to help combat that virus or bacteria or whatever it is. It's going to open up the orifices, the nose, the nasopharynx, so that you can breathe more clearly. So that's just that herb, right? But then you also have, I can't remember who said it, but somebody picked out date. So this is, it's a specific date called Dazao. And it's got a nourishing flavor. It's very sweet. Like when you eat a date, you don't have this, date. It's more like, sweet flavor, right? Like you've got that kind of like comfy feeling in you almost, like, or that settled feeling. Like when you have something sweet, it kind of helps to settle things down a little bit. So now you're taking that very outward moving flavor of the cinnamon and you're grounding it a little bit with this a little bit more nourishing. So you've got, say, hypothetically, cold, right? You want to bring all of your resources out to fight the cold, to fight the bacteria or the viruses. But you also want to support where that energy is coming from. So you need to nourish the person. So you've got the date to bring that sweetness, to bring that nourishment in. Then let's see, Gua Sha, this is a really important herb that's a little complicated to describe, so I'm not going to. But the next one that you might recognize, give that one a sniff and send that one around. This will really taste your, or test your taste buds. Yeah. Yeah. Yeah, so that's a great question. So we can and we will do in the future, but not far off. It's not a fruit, but it's going to be hard because, and I'll tell you why. So it's a little bit of a trick question. Oh, thank you. Perfect.
So you were saying that you're going to be doing it.
Yeah, so we will probably in the next year or two have a raw herb pharmacy, which is great because it's way more fun, but it's also great because it's way stronger. It's basically the medicine direct to you. You can see the ingredients. What we would do, the easiest way to use that, the traditional way is you make a soup out of it. So you would put this in a certain amount of water, boil it for a certain number of hours and drink the water, right? What we do is we grind it all up into a powder. You stick it in a thermos, pour boiling water in, overnight it steeps, and then you just drink the water in the morning. Way easier to use. But what we do, there you go. Okay, quiz at home. What is it? No. It is a part of it is a bark. Yeah. So what it is licorice. But and the reason you can't smell it as licorice specific, other than licorice is actually kind of hard to smell, is that it's called meager, which means honey processed, right? So licorice has an action. It's very nourishing. It's very nourishing to the heart specifically. But when you fry it in honey, in the sugar, it takes that nourishing action and makes it a little bit sweeter. So again, we're talking a little bit more, we're able to gradate even an individual ingredient by processing it and making the tendencies of that ingredient slightly different as well. So everything is almost infinitely adjustable to make it perfect for that person's presentation. So back to use though, traditionally, again, you would make a soup, you would drink it. What we do is we cheat and everything is powdered. So they make the soup in these big vats, and it's all sterile, and they blow it through a machine that sticks it to a powder and makes it shelf stable. And then we can take that powder, you just add hot water. And this is, so the way you would take this at home is you add the water, let it settle for a little bit, and then drink it back. This formula, you would be able to sip and it would taste delicious. That is in the minority. I will be totally honest with you. Most of the herbal formula tastes pretty bad, but it's very quick. You knock it back, curse my name usually, and move on with your day. One of the questions that you can actually smell that. So, oh yeah, sorry, use the handle. It can do, but remember what we were saying about taste, right? How taste and smell and that experience of it. A good way to explain that is if you squeeze a lemon into your mouth, right? What happens? Everything, like your mouth puckers, it fills with moisture, and everything kind of goes, oh, sour, right? The taste will create a physiological response. You can encapsulate, and very often people do to get past the icky taste, but what you're not getting is that initial interaction with the chemistry of the formula. So I don't like to do it, is the answer to that question. It's not just that I want to torture all my patients.
We have a question here.
Please.
Asking if it's gluten-free.
Good question. This is gluten-free, and all of the things that we have here are gluten-free, but there are none of the ingredients we have are glutinous, but there are some things that can interact in a way that might upset a gluten-free person. So when we're doing the intake, that's on our list of things we would never want to give a formula that would hurt a gluten-free person to a gluten-free person, because that's a part of their pattern, right? So even if you take a step back from gluten itself as a chemistry, gluten is very sticky. It's a very solidifying thing. And part of why it interacts poorly with gluten-sensitive people is because they don't respond well to things that are sticky and stuck and act in that way in the digestive system. So in terms of creating that pattern for that person, we would probably, like, even without knowing that they're gluten-free, we would have them on almost the opposite formula as a way to balance out their digestive system. So good question. Yeah.
Now, what if somebody has celiac?
So that's gluten allergy. Yeah. Well, right. No, so exactly right. So we wouldn't, if people were celiac, even without knowing that they're celiac, by figuring out the rest of that pattern, they would never be put on the formula that would irritate them. Does that make sense? But even without that, the formulas themselves are gluten-free. Right.
The herbs or the acupuncture be able to help with the digestive issue that people with celiacs have?
One of the most common things we work with. And again, like Marielle was saying, very often with celiacs or digestive issues in that way, you get to an end point in Western medicine, right? Where, say, if you're diagnosed with celiac, the end point is very much, you can take this medication if you're having a flare-up, but otherwise it's a restriction, dietary restriction, right? In general, there are exceptions to this. Most allergies involve an overexpression of the immune system. It's almost like the immune system starts to attack the body instead of attacking other stuff, right? So even just looked at that way, if we calm down the immune system, get it to recognize you and differentiate you from everything else, then you won't actually have that sensitivity anymore, right? So the short answer is yes, we treat that quite a lot. The longer answer is that depending on if there's an actual allergy, if it's a sensitivity, and if it's a misdiagnosis, which we see all the time, it will be a very different treatment path, right? Very often what we want to do is, with acupuncture, with herbs, whatever, is we want to, as quickly as possible, take care of the symptoms so it's not ruining your life, right? So again, with the arthritis, get you pain-free so that you can move, so that you can go about your life, and then see, is there something underlying here that we also need to take care of so that it doesn't come back, so that it doesn't go somewhere else, right? Yeah, did that answer your question?
Yep.
Perfect, excellent. So when you smelled this, did you smell the licorice or the cinnamon? Exactly right, because all of the other ingredients have really pulled that pungent, aromatic, really nice tasting cinnamon down and grounded it. It ends up tasting almost a little bit muddy, right? Almost a little bit like, yeah, okay, awesome. So for a whole bunch of weird reasons, that's a perfect description, because what this does is really ground you in what we would call earth, which is the digestive system, bringing you back to getting the strength of your metabolism working for you, instead of either being blocked so it can't work for you, or working too much so that you're miserable with all the cold symptoms without it resolving. Cool. Yes?
About the amount that you would drink per day, just a small amount like that?
Yeah, so good question. So because of the concentration of the granules, almost always the therapeutic dose is 4, do we have a spoon here? Yeah, she'll get one. 4 little spoons in a mug, covered with about this much water. The amount of water doesn't matter. No, I don't actually know why I have that one. Perfect. 4 of these in a mug. The amount of water doesn't matter so much. So what I say is try about this much, let it cool, shoot it back. The perfect one for the nasty tasting herbs is enough water that it's really liquid and it just goes down the spout, without being so much water that you have to sip it again, because people don't, and then chuck the rest out. Yeah, that's perfect, right? So this is an amount for me that I can knock back in one, but it's also really nice and liquid, so it's not like getting too sticky. Here's an interesting thing though, I have to say with the flavors, what you'll often find is, I tell everybody, like, this formula is going to taste gross, right? If it's a gross one, I don't want to surprise anyone. So I'll tell them, and they'll come back the next week and say, you know what, you were right. It tasted horrendous, but I love it. And it's this weird thing where, for instance, like the sour flavor is really, it will get you. Like if something's really sour, it makes your whole body react to it. But for instance, with me, the pattern that I have, the like my weak link, for lack of a better phrase, really loves the sour flavor, because I tend to be out here too much. And the sour flavor, it's puckering, right? It brings everything in, right? So a lot of my formulas, whatever my symptom is, will include a little bit of sour, right? And a lot of those, because they're not just sour, they're intensely sour for me. So a lot of them, I'll taste them. I'll be like, oh, that's horrendous. And every morning at 8, I'll be like, I need some horrendous right now. And it just starts to, like, your body almost craves, or not craves, but it starts to really appreciate that thing, right? So again, a lot of people come in and they're like, you know, it's totally right. The taste itself, if I had to label it, wouldn't be something that I would want, but I want it. And my body really responds well to it. The other thing to note about Chinese herbal medicine is that a side effect is your body telling you that something is imbalanced still, right? So some side effects we're kind of okay with, because that, like the first time you have it and feeling a little bit grumbly in the stomach, like your stomach doesn't really know what to do with it, goes away after having it a couple times. That's one of those things that we can, like, as long as you can get past it, we're okay with that. But anything else, that side effect is an indication that we haven't totally nailed that pattern yet, right? So we keep fine tuning it until there aren't any side effects. Theoretically, we shouldn't have any side effects. It should only be positive. So it sounds too good to be true in a way, but it's a fundamental aspect of this medicine that a balanced internal ecosystem should feel really great. So if we're getting the balance right, you should just feel really great. Over to you. Before you
over to Marielle.
Yeah.
When I came and did a pre-conversation with you guys, I said, so is this a supplement? And
yeah.
The answer is
no. So the longer answer, the truer answer, not too long, is that herbs are regulated by the supplement, like the same body that regulates supplements, right? So for instance, these herbs are third-party tested. They're tested in the country, they're tested outside of the country, and they're also tested in America, to make sure that there aren't any adulterants, pesticides, weird things in general in it, to make sure that the herbs that are supposed to be in there, because it's a powder, are actually the herbs that are in it. So there's spectrographic, there's a whole bunch of different things that are done to make sure that it's the right thing. So that's all. We get that because we're regulated by the supplement industry, which is great. But supplements are given generally with the idea that you don't have enough of this thing, right? So you take a vitamin D supplement because somebody took a blood test and you don't have enough vitamin D, so you take that to get more of it, right? In general, it's not always true, of course. What this is a corrective medicine. So it's a lot less, you don't have this, have this. It's a lot more, like if you think of a, what do they call it? Teeter-totter, seesaw, right? If your imbalance is like this, it's a corrective measure on the seesaw to bring you back to balance, right? So if you imagine a seesaw with like 100 different balance points, 100 different wings on it, right? The ideal formula is one that takes into account all of the ways that those little balance points are askew and brings them back into balance, right? So we overuse, we definitely, well, maybe we don't use enough the word balance in medicine. It's all about seeing what's out of balance and bringing it back into balance. And yeah, there you go. Just going to end on balance.
For the herbal supplements that you prescribe,
the herbal medicine, yeah. Yeah.
So is there like a common ailment that is happening that you are prescribing your formulas to?
Yeah, great question. It's an easier answer to say what we're not prescribing them for. We don't often use herbs first for pain or injuries, musculoskeletal stuff. We probably should do that more, but we tend to really focus on acupuncture and bodywork and Gua Sha and cupping. More we're using herbs initially for digestive issues, obstetric or gynecological issues, respiratory issues, allergies, things like that, internal organ stuff. That said, a lot of times if we have a tough case with like a chronic pain condition, it does have to do with an internal imbalance. So at that point, we'll start to give herbs even for that. Again, like Marielle was saying, Chinese medicine is a total medicine. It's a complete medicine. So theoretically, there's not a lot that it can't address, right? The question then becomes, can we address it the best? Or will like Western medicine just be the better fix for you, right? For instance, there is a formula that we have here that helps to staunch bleeding, right? And it was used, initially it was developed during wartime, and all of the soldiers, all of the soldiers would have in their lapel a pill of this formula, and they could just kind of bite it out if they got stabbed, right? If somebody comes in here and gets stabbed, they're going to go to the hospital, right? So the answer to the question, can you help us with this, is yes, always, almost. The really true answer is, are we the best avenue for you? So often during that initial meeting, we might pause and say, you know what, like there are some other routes that might get you where you need to go a little bit faster. Why don't you try those out? And then if you're still in discomfort or imbalance, then come back and maybe we can fill in the picture a little bit. But a lot of our job is to help people find the right medicine for them, whether or not it's what we do.
Thank you.
Tag, you're it.
All right, don't forget to swap the earbud.
Oh, thank you.
Oh yeah. What are we are on?
We are at 4. Okay, I don't want to take up too much more, so we have time for.
Everybody thought until 5. We're the only ones who knew it was only an hour and a half. So if you need a full hour.
Oh no, it's okay. Because I want to also be able to show people around a little bit and not be so lecture based. So let's see, just a little bit more about like basics. So when someone comes in for a treatment, they fill out paperwork like in most healthcare facilities. Ours is pretty extensive. It asks a lot of questions, and because we were talking about how we see the person as a whole system, it's going to ask about things, let's say someone's coming in for, issues with their stomach, but we're asking about, sinus congestion. We're asking about all other kinds of presentations, pain, things like that. And they think, well, that doesn't have anything to do with what I'm talking about. I'm talking about this one thing. Typically, because of how we diagnose, the pattern diagnosis, and looking at all the systems in the body, we want that information because it's going to give us more information of how can we help the person most. So that's why when you go to an acupuncturist, they're asking you a ton of questions, because we want to get as much information as we can to get a clearer picture of what's going on, what the presentation is. So that's step one. And then when you come in, we would go over that with the patient, talk about, have them kind of elaborate on what's going on for them and give us the whole story. And then we would have a treatment. And almost always acupuncture is involved. Doesn't have to be. Sometimes we would just do cupping or Gua Sha or moxibustion. But so let me just, before I quickly jump to those, we're going to talk about the needles. So you can't, it's hard to show these on a screen because they're so thin. It just looks like you can't see it really. But I could pass one of these around. Just don't open it, but you can look at it to see just like how thin they are. If you want, if you're interested, Melissa, you don't have to look at it. Yeah. So we're always gonna use sterile needles, and they're individual, they're only one-time use, and then afterwards they go in a biohazard bin. We don't use a ton of needles. So that's the other thing. You see all these pictures on the internet of people, it's always in the face too. It's always like a ton of needles in the face. Yeah. And there are people, there are acupuncturists who practice like that. So there are some that I have had patients that they'll tell me I had an acupuncturist that put like 30 plus needles in me.
Truthfully, that's all I knew.
Yeah. So that is a way that some do. Most often not. Most often that is not the case. So most often you're dealing with, at least with us, you're dealing with 10 needles, 6, sometimes less, sometimes like 4 needles. If the person is very young, even fewer needles, because their system is so active and changing so much that really you don't have to do a lot to shift anything. So you wouldn't use that many needles. Also, if the person is very weak, you're not going to use a lot of needles, because as I explained earlier with acupuncture, we're dealing with movement. And if the person is very weak, too much movement could be too much for their system. So segue from that is that you would use something more like moxibustion. So moxibustion is mugwort leaves that have been dried for about 3 years. So it differs. So some people will age it for longer, and then ground into a powder. And actually, I'll take some of this out so you can see.
Real quick, how many needles were in that one container?
10. Okay. Yeah, so it's 10 needles. So if you look at the powder, it's not like loose powder. It's kind of sticky. It kind of sticks together. And you can make it into these little cones. So if I mush it like that, I make it into a little cone. Now that size I could put on top of a needle. So that's needle top moxa. And then I would light it and it would burn slowly and warm the point and warm the needle. It feels really nice. The moxa is even more relaxing than the acupuncture, because it's like, who doesn't like warmth added to any situation? But also, if I put this is a little bit big, if I put this on top of a ginger slice, so that it the ginger is the buffer between the moxa and the skin, I could do that. I could also put, you know how we were talking about in the navel, how we wouldn't needle the navel? Well, often what you can do is you put salt in the navel and then you put the moxa on top of it. This is still too big to go in that area. It would be smaller. It would be about, let's say, that big. And you do multiple rounds. So you would do, whether it's the needle top, whether it's on top of another herb like ginger or a poultice of many herbs, or on top of salt in the umbilicus, you're going to do multiple rounds. And you're sending that heat to warm up that point. And what moxa is doing more so is it's working more for cold conditions. It can help to break up scar tissue. It's moving the chi in a different way, but it's also supplementing more. So it's adding warmth into an area. It's also used to resolve dampness, which is a type of pathogenic accumulation of fluids in the body. And if you think about it, it kind of makes sense. If you have dampness, this pathological accumulation of fluids in an area, the heat is going to dry it up. So it can also work for heat conditions. So often when I have people that are coming in that are dealing with hot flashes specifically, or heat just stuck in the upper part of the body, if I moxa a lower part of the body, that's going to circulate that heat, because it's not that they have too much heat. They have too much heat in one part of the body. And that's the problem. It's really specific person to person. The other thing about moxibustion is that they've done studies that show that it can increase white blood cell count. So especially on a particular point on the legs. So that's another interesting thing about it. Also, the fact that it breaks up scar tissue is great. So often used on old scars, surgical scars, cesarean scars. Let's see, what else about moxibustion did I want to say? Traditionally, acupuncture, the term for acupuncture is Zhenju. And for moxibustion, it's Jufa. So together, they're supposed to be used together traditionally, right? So you wouldn't rarely have acupuncture without moxibustion. In this country, it's not as often. Mostly it's a ventilation issue. Thankfully, one of the reasons that we have constructed our space in such a way, we put in these vent systems so we can use as much moxibustion as we want, and it replaces the air in the room and sucks it up and sends it outside. Just so happens that because of COVID, that's worked out really well for us. So it exchanges the air in the room every however minutes. How many minutes does it change the air? At its slowest, 3 times a minute. Okay, great. So that's helpful, but mainly we did it for the moxa so that we could do as much as we wanted and the room wouldn't be filled with smoke. And typically that's the issue in this country, why it's not used as much is because of the smoke, also because it takes a lot of time to do, because you're doing it yourself. It's not something that you can just like put on and then leave the room. Let's see. Oh, another really cool thing about moxa is that it's used often in the presentation of breech babies. So there's a point on the foot that you moxa, and it will, because of the channel that it's on and where it goes to, it will allow more space in the area and will often get the baby to turn into the right position. So if someone comes in at around 32 weeks is better, like the earlier the better, that we have, the more time we have to get the baby to turn. But oftentimes it'll take just a few sessions. Often we can send someone home with a moxa stick to do it themselves. So that's, I think, one of the coolest things about moxibustion.
So glad you said 32 weeks because I pictured delivery room like lighting a toe on.
Oh,
I was like, how is that working?
Yeah. No, it's you do want some more time. I've had people come in at 37 weeks and it's been fine. So I say 32 weeks because the more time you give us, the better. And we would use it in conjunction with acupuncture as well, but all based in just helping with any constriction in the area that's keeping the baby from being able to move. That being said, the baby will come when the baby comes, the baby will do what the baby will do, but these things can help. And they've done a lot of studies on it, of how it's helped, and especially helping with easing into labor, and definitely also with postnatal. So helping with all of the things that can come up with postnatal presentations. So really helpful in that sense. Let me just talk real quick about cupping and Gua Sha, because those are the other things that we do that we're talking about. So cupping, many people have probably seen like the pictures of cupping marks or even had it done. There's a lot of ways to do it. Sometimes people use the suction pumps. They're like a plastic cup with a suction pump to it. Oftentimes they use like a silicone cup that they squeeze and then put on and let go, and it will create suction. Mainly what we do is traditional fire cupping. And that's, we have these thick glass cups. They have to be thick. And we'll usually put oil on the area. Usually we're cupping the upper back, the shoulders, the back. But we can also cup quadriceps very frequently as well to help with that. The IT band, that's very sensitive. So, we work up to that. But what we do is we'll take a hemostat, which is these long needles, not needles, tweezers, pliers. There you go. Pliers, right? And we put alcohol swab in them, light it on fire so it creates a little flame, put it inside the cup, and then put it on the skin. And what that does is that heat, that hot air creates a vacuum, and then that vacuum will then pull the skin up. And what that's doing is doing a couple things. So one, it's stretching the tissues, not just the muscle tissue, but also the connective tissue, which is the fascia, the tendons, the ligaments. So really great in areas like on the sacrum and sacral area where there's not a lot of muscle there, it's mostly attachments. And that's really great for stretching out that area. I think it feels really good. Most people say it feels really good. So it's like having a 90-minute deep tissue massage in a couple minutes. The cups only stay on for a couple minutes, maybe a few minutes, depending. The thing that will determine how long they stay on sometimes is the discoloration that can appear. And that discoloration is not a bruise. It is stagnation in the tissues that we're pulling up to the surface. So what that stagnation is cellular debris. So sometimes people will say, oh, it's toxins. I mean, sure. I mean, it's not supposed to be there. We could look at it like that, but I think that's kind of a harsh word because you could have had a totally clean living life and still end up with stagnation in an area. Typically, you're going to get more discoloration in an area that you've had trauma to, or an injury at, or a place where you hold a lot of tension, or an area of overuse, if you have chronic overuse in an area. And it'll come up as this sometimes red discoloration, sometimes purple. And it's the dead cells, like dead red blood cells, dead platelets, dead any kinds of dead cells of tissues that would usually get either reused, parts reused and flushed out, or just flushed out. And because of that tension in the area, because of the overuse, because of trauma, they get stuck in the tissue. And when they start to get stuck in the tissue, more get stuck. It's like a traffic jam. So now you have decreased blood and oxygen coming to the tissues of an area, and that's going to increase the pain. So like we were talking about blockages earlier, like it's another kind of blockage, right, in an area, and it's going to cause more pain. So that's what it's doing. Cupping is great because it's pulling that discoloration up. It's fun. I like it. I get very excited when we get a lot of color. What it tells me when we get that color is that you're going to have more relief faster in that area because we're removing that stagnation. The more you do it, the less shows up. And that's when it gets really fun, because then when I cup the next time, we see these little like semicircle like marks where it's lighter, because you can literally see where it's been cupped already. So it right away, you can start seeing a difference in the presentation. That's why it's not bruising, because bruising would appear the same every time. You can bruise from cupping, but that doesn't happen very often. And that's not what the discoloration is. Gua Sha is a scraping technique. So we would often use, traditionally it's a spoon like this, and it's anything that has this edge. So most people now have heard of Gua Sha as for like facial rejuvenation, like for their face to help with lines and wrinkles and things like that. It's great. This is different. What we're using this for is similar to cupping in that it's bringing up a discoloration. We're looking for that discoloration, and that's bringing it up to the surface, but this is more superficial. So this is going to be not as deep as the cupping. So usually, let's say someone comes in with neck and shoulder pain. I'm going to start with Gua Sha because one, I can get up the neck, I can get to the sides of the neck, and which I can't do with cupping, and starting a little bit more superficial and then working our way in with, and then eventually we can get to the cupping. However, that's not always. Sometimes we just might jump straight into the cupping depending on the person's presentation. We can also use Gua Sha if someone starts to get a cold. So as soon as at the beginning they start to feel like, oh, I'm coming down with something, you do Gua Sha on the upper back and neck, and it will express that out faster. And you might feel like sick for a day, and then it goes away. It's like you just go through it a lot faster with the Gua Sha. That's one of the main traditional uses of Gua Sha. Like any house in China, they'll be like, oh, you're not feeling well? Let's Gua Sha right away. So that's one of the uses for that. It's also, both of them, you could look at as a heat venting process. So someone comes in with night sweats or anxiety and this type of like heat building pressure up in their upper body, headaches, presentations, things like that. But it's more of like an excess, like things are just getting stuck in the upper body. We can Gua Sha that area and it relieves not only tension, but it relieves that stagnation, which is keeping things from circulating. So once we relieve that, things can circulate better and they'll find that they're not as hot. They'll find that they can sleep better. They'll find that the tension is better. So all these, we can see changes right away with using Gua Sha and cupping. Oh, I didn't point out the pull for moxibustion. So sometimes we use the loose moxa, and sometimes people, more characteristically, people use pull moxa, and you just light it and then hold it over a point, and then that's how you warm it. You can also make moxa boxes, which is like a box for a whole area, and you would use it on typically the abdomen of a person, but you could also put it on the back anytime that you need a wide area used. Did you have something you wanted to show, honey?
No, it's just the pictures. You wanted to show the pictures.
Oh, sure. Yeah. Do you want me to show the pictures of Gua Sha? So if people want to see.
Could you show loosely?
Oh, yeah. So let's say I'd put oil in there. So also a lot, like I use it for epicondylitis, right? So like any tennis elbow, like someone has pain bending, straightening their elbow, put oil on the area and then unidirectional scraping. And I don't know if you can see, but I'm engaging the tissue. So I'm not just like, it's not loose. I'm not like barely touching it. It's not feather light. I'm using sufficient pressure, but let's say someone comes in and it's too sensitive for them. We can go lighter, but then you need more strokes. So there's ways to work with it. I would say about, a third of people, there's 3 different groups, not a third. So most people like the way that Gua Sha feels, or they can put up with it enough because they like the way it feels afterwards. There is a small group of people that just cannot tolerate it. It's too much. It's like too tickly, and we move on from there. So then that's just not. We have other options. Did you want me to show? Yeah. So if people have seen the cupping marks, so let's see if I can get some Gua Sha. Okay. So this is what the Gua Sha marks can look like, and you can pass that around. Well, why do you say that? Well, but that lasts for like 2 days.
So imagine that every night you have hot flashes and you can't sleep for months.
Yeah.
And then after 2 days, the marks are gone and you don't have the hot flashes anymore. You can imagine how that becomes a pretty good cell.
Yeah. Or you have neck pain and headaches, and those keep you up at night. So yeah, we always tell people about the marks that can come up, but the marks of Gua Sha go away much faster than cupping because the Gua Sha is more superficial, like I said. So you have to drink lots of water. There's some self-care involved. You have to drink more water. You have to keep it warm and covered for 2 days and rest the area. So like if we Gua Sha your upper back, don't go out and do a heavy upper body workout, but just for 2 days, and then you can do whatever you want. Same thing with cupping. With cupping, the marks can last up to a week, but they fade over time as well. The more water you can drink, the better it works. And honestly, like I've had patients that, they end up going to weddings like after getting cupped because they're like, nope, like I felt too good after cupping. I'm not going a week without cupping, even if I'm wearing a gown at a wedding. I don't care. So, but everyone has their thing. Some people are like, no, I'm going to the beach and I don't want people to see me and I don't want people to ask me questions. So everyone's different. So, but the thing is that it's becoming more and more visible in this culture now that we're more and more accepting of it. You know, at first it's like, oh my God, what a weirdo, who did that to you? And like all of that. But now it's like, oh, cupping. Oh, I recognize that. Oh, Michael Phelps, like, yeah, like Michael Phelps, like he did so much for our medicine. Oh yeah, Gwyneth Paltrow also, although I hear crazy things about like charging $400 for a cupping session or something like that. That's insane. So all of this is, you know, the Gua Sha, the cupping, the moxibustion, not so much, but the Gua Sha and the cupping is more folk medicine. You know, it's like medicine of the people. And, you know, when people charge, you know, exorbitant amounts of money for that, I find it really unethical. But anyway, moving on, as we were talking about earlier with the magnets and the ear seeds are another way of, and the magnets of just making the treatment last longer. So we could put ear seeds on an area that, and here, I'll pass those around too. And they're literally seeds of a plant that have an adhesive on the back, like a Band-Aid adhesive, and it just holds the seed and on the point. So it's like a acupressure, like we were talking about earlier, to stimulate that point and make it last longer. Auricular acupuncture is very effective, and ear seeds are a great addition to treatments.
It also makes you able to directly connect with the stimulation of the point. So
yeah.
For instance, in things that involve like addiction, for instance, where you want to, like, say you're addicted to cigarettes, right? And you're trying to get off cigarettes. When you want a cigarette, you got to have something in your hands, right? So giving people a thing to do with their hands that involves an action and stimulates the point that will help.
No, it's okay. I just thought about it. Yeah.
It takes care of a whole bunch of different things all in one, right? And it also connects people into their treatment. So it's not just something foreign somebody's doing to you. It's something that you can also do to you. Like I have very often when I'm treating children, they've heard about needles and they're scared because their parents are scared, not because they're scared. They don't know enough to be scared of needles yet, right? But I'll just have them tap a needle on me. And as soon as they get access to that, it then becomes a tool and the comfort level increases dramatically. So getting people in touch with their own treatment, it can be hugely important.
Did people hear that?
I haven't seen anything, so.
Okay. All right. Okay. Let's see. I think that is. Oh, yay! Excellent. Did anyone have any more questions? No? Well, I don't like needles. I'm also very needle sensitive, so I feel it very strongly, the sensation. So I basically, I tell them we can start wherever they're at. So we can start with very like light stimulation, just a few needles, doesn't have to be anything crazy, and work with where they're comfortable. You know, if we put in a needle, it's too much, we take it out. There's also in and out insertion. So just because the needle comes out doesn't mean it's not working anymore, right? Because we talked about that micro-inflammatory response before. We've punctured a site. So there's already something physically happening in that area. So the treatment's still going even after you leave. So even if we're doing in and out treatment, like in and out needling, that's something we could do. Like if they can't lie still with the needle, we could use fewer needles. We can use sites that wouldn't upset them as much. We can have them face down so that they don't see anything. We can have them face up if they feel too vulnerable being face down. There's tons of ways we can work with it. It's very dynamic. So it doesn't have to be like, oh, I want to do this point in that person. They have to grit and bear it and feel that point. The funniest thing is that I've had so many patients that are like really scared when they come in, like really scared, like they can't take more than a couple needles, more than a few needles. And I have them breathe during it. That really helps. So if they inhale and then exhale as the needle is going in, that really helps with the sensation and helping them relax. And now those patients, like they can't even remember like the time that they didn't like needles. They're just like, oh, it's no thing now. So oftentimes it's a psychological fear that people deal with. So fainting does happen. It happens very rarely, and that's just something that most people don't faint. I think I've had one person faint on me in all my time, even through school. And you think you haven't had any people faint on you? Or like
I had one in school.
One in school, yeah.
So in 8 years.
Yeah. So it's rare, you know. We do ask people that they sorry, I'm kind of going off on a tangent. But we also tell people like to eat food before coming in. So don't come in on like an empty stomach and you know it's like 3 o'clock and they're like, I haven't eaten anything all day or drank anything all day. Because we need, like we're talking about that qi, that vital substance, we need them to have that from their nourishment so that we have something to work with. You know, also during a treatment, blood pressure drops, and blood pressure, if our blood sugar is also low, can lead to people feeling lightheaded and dizzy. So that's something that we have to work with as well, is making sure that people have eaten, that you know, they've drank water, and then afterwards, it's best if people can, you know, ride the relaxation wave of treatment, you know, into the day and not plan something really hectic afterwards, you know, because it's kind of a bummer. You come out like with this floaty, relaxed feeling, and then it's like, oh no, now I have like a super stressful meeting, you know. So that's what we recommend. What did you want to say?
The other thing about
do you want the earpiece?
Do I?
The other thing, I mean, the question that you asked about what do you say to people who don't like needles, that's the number one thing that people come in with. And we look at it, like Marielle was saying, like meeting you where you are for sure, but it's also one of those things where to some extent we can kind of explain how it's fine, explain how everybody's okay with it usually, but until you have it, you don't know that, right? So very often what we're getting is people are nervous, we talk them through it, we ask them if it's okay to proceed, we proceed. After that first one, we almost always get this like, are you done? Yeah, right? Like, yeah, and so then we get to really engage with like, yeah, it's in. You've had acupuncture, you get the t-shirt, congratulations. But then we get to work with it, right? So once that, until that first time when you have acupuncture, there's always going to be something in the back of your head like, well, what if? Because I go to the doctor and they take blood and it's awful every time, right? This is nothing like that. But then we can start the process of really engaging with like what's actually going on, right? So you're past the fear response. Now we can get down to the cool stuff, right? But the other thing too is that we always assume, even if people don't tell us, that they don't like needles, right? Like we have to assume that everyone's coming in here with a deathly fear of needles, because then we can proceed like knowing that, you know, we've got some talking to do, and we've got some understanding to do, as opposed to you just coming in being like, okay, so we're going to start, right? And then nobody feels comfortable. So yeah, that's my take on that one.
But question, thank you. Yeah.
You come in for your first session. Well, I was here for my first session and it got messed up, and I was on the wrong day.
Doreen.
Yes.
Yes. I was like, she looks so familiar.
By the time, you know, it all came past, this thing had been feeling okay.
Great.
I love acupuncture. I've had it for after chemo, and I could never have made it through as well as I did without it. I think they shouldn't be called needles. They should be called threads.
Right. Yeah.
Not, but anyway.
There's a push to do exactly that, because you're right.
Yeah.
But if I was to come back, or when anyone decides to have a session, would the talking happen like in the first 15 minutes and then you would go into a room and have the treatment?
No, you go, so people come in. It's a great question. So people will come in, we, show them to the space, like orient them, in terms of parking, bathroom, important stuff. And we take them into a room, and then they would have filled out their forms already online. So we would email the forms to them. Nothing has to be printed out. They fill out everything online, submit it back to us. So we already have it. And then most of the time, sometimes people don't have a computer or access to a computer, and so they fill it out here. It's totally fine. And then we go over it together. So then we sit down, we're talking for, a half an hour, most of the time, sometimes longer. It depends on the person's issues, sometimes less. Sometimes it's really like simple, like, I woke up this morning and this is the issue. But typically it's about a half an hour to go over all the paperwork and talk and have the person talk about what's going on for them and what specifically is happening. We ask a lot of questions. We ask a lot of, specific questions. So if someone's talking about anxiety, which happens a lot, how does anxiety present for that person? Is going to be different how it presents for another person. So, is it more like in the chest? Is it more in the stomach? Like, we're going to ask all of these things. So we get very specific. So we would be talking for like half an hour or so, and then we start with the treatment. And then we start with, depending on what it is, we might start with acupuncture. We might start with the cupping or Gua Sha, and incorporate moxibustion. Nothing costs extra either, just so everyone knows. It's all like, you have us for the time and we fit in whatever we can do in that time. Does that answer your question?
Yes.
Yeah? Okay. What else did I just think of when I said that? Oh, with the herbs, we forgot to mention, we don't make a profit off of the herbs. So any herbal formulas that you're prescribed, you're actually getting them at wholesale value, because we consider the price of the session. It includes the herbs, like us not making a profit off of the herbs, but you just pay for the baseline cost of the herbs. Right. And the ethics of it being that we're prescribing something, if we're making a profit off of something that we're prescribing within that realm of that practice, it kind of is like, well, then ethically it becomes difficult if we're also making a profit off of something that we're prescribing for you to take. That's why doctors don't make any money off of legally they're not supposed to make profits off of the prescriptions that they fill. Yeah.
Between sessions, so like for your first one, you have your first session, and you said it might take like 2 to 3 months for something to improve. Yeah. So would it be a couple times a week, or maybe once a week over 2 to 3 months?
That's a really good question. It depends on the severity of the issue. So let's say someone, recent thing, very acute, I'd say, you know what, come in 2 to 3 times a week, we'll bang it out in 2 weeks. As opposed to, doling it out longer. Not everyone can do that.
But
so
it's not like a rule, like you can't
no.
do it the next day because something needs to heal over the next 4 days.
Well, with cupping, it's more of a rule. So with cupping and Gua Sha. So with that, I wouldn't cup the next day. Yeah, like that would have to wait a week, because there's a certain amount of trauma that's done to the tissues directly that we need it time to heal. But acupuncture and moxibustion, no, classically you read about protocols where it's like the patient comes in 3 days in a row, like 3 days on, 3 days off, 3 days on for 21 days or something like that. Like there's all these kinds of things classically, but what works, it doesn't work for us and always in this culture, in this lifestyle, right? So that's not always going to work for people here. I can't be like, come in 3 days in a row and then 3 days off and then 3 days again for this thing. So typically what we'll work with is once a week when we're starting, right? Because we're trying to change that internal imbalance, right? And we're trying to, with the acupuncture, we're giving the body information that we're trying to nudge it into, like Andrew was talking about, into balance. the body wants homeostasis above all else. If it found a rut, it wants to stay in that rut. That's what it wants. So it's always going to try to teeter back. So we have to then nudge it back again. We have to keep giving it that information. So that's why acupuncture, one of the things, it's actually cumulative. So even for something like pain, you know, what we're measuring is, or anything really, we're measuring how much relief are you getting in a session? How long is it lasting for? You know, and what's the severity of it? And then every time you come in, it's like, did you feel more relief? Was it less relief? Did it last for as long? Did it last for longer? We're measuring it in these ways. And typically what we're seeing is that every time the relief increases and the duration of the relief increases. So then we get to the point where, okay, you are good for like a week, you're having no symptoms. Like this is what's happening. Like you start to go every 2 weeks. Or even before it gets to that point, the person's like, you know what, I'm feeling good enough. I want to start coming every 2 weeks. We start doing that. And then 3 weeks, then maybe it's once a month. Then, you know, or it just jumps to like, you know what, actually, this is fine. Like I had a patient who had broke his hip in a couple places, and he couldn't walk, and we were getting him to move again. And he was coming in, I think, twice a week for, you know, a while. And then, you know, he started being like, actually, I'm, you know, feeling much better. I'm going to come in once a week. And then it was once a week. And then he just was like, no, actually, I don't need this anymore. I'm totally fine. And then he just stopped. So the person feels it out too. You know, it's like actually, and we're always talking about things to do at home also. We're always talking about, you know, what changes can you make for lifestyle, and like stretches and things like that for pain, and, you know, home remedies that you can do that the person can then also be responsible, be involved, and take a step in their health, and then to keep them from coming back, you know, so to keep them to a point where, okay, I have these skills now on my own, that when I start to feel things going out of balance, I can rein it in myself. If I want, I can make an appointment for acupuncture. I know that's there, but I also have these tools to work with on my own. Yeah.
We've got about 15 minutes left. I don't know if you wanted to do a tour.
Yeah, I wanted to show people the rooms. Is that okay? Just if people are interested or not, I don't know. But unless, does anyone have any more questions that they
I have one quick question.
Yeah.
You are getting treated for allergies, although urologists and pulmonary doctors fight it back and forth. They cannot get it right.
Yeah.
It's been going on for, say, 11 years. But
random number, 11 years. Yeah.
But is that like a lifelong thing? Because allergies are kind of lifelong, right? I mean, so are pulmonary. They don't have to be.
No. So you can think about it. Almost all of these internal imbalance issues can be chronic, lifelong. There's a constitutional, like what you were.
Sorry. So there's a constitutional component to it, like what you were given, you know, genetically or whatnot. There's an exposure and environmental component of it. And then there's a link between those two, how it's developed over time. So of course we can't change what you were given, but we can change how your body is reacting to the environment. So again, that allergic response is an action of your body or by your body towards something. So what we can adjust is not your body, like the body as it is, but we can adjust what the response is, right? So, and again, like Marielle was talking about, a lot of it is additive. So allergies are very rarely you're allergic to one thing. There are some for sure, but very often you're more sensitive to one thing, but really only in the presence of 4 or 5 other things. Like you'll find that you're allergic to, say, hayseed, right, or grass, but only really when the temperature is changing, or only when there's also ragweed, or only when you're also stressed, or when you've been exercising, right? So there's a lot of these additive things that we can then almost like leverage, so that, are you always going to be sensitive to that thing? Possibly, but we can adjust how all of those additive features are increasing that sensitivity to the point where you're feeling symptoms. Does that make sense? Okay.
Tour begin.
All right. I'll just show you guys a treatment room just so you get an idea. So all the chairs have been taken out because we're using them out there, but we would have a chair over there and chair over there, and we talk. And then the tables, you would be on the table. You could be face down or face up. We have face cradles if people are going to be face down. All the tables have heating pads. And then we also have this TDP heat lamp. And what it is, it's a far infrared light that works. It has a plate in it that has 33 minerals added to it. And when they're heated, it creates a far infrared. And what that does is it's really great for pain and inflammation, and it increases circulation in an area. So they've done studies on just using heat lamps for things like arthritis, and it has been beneficial. So we incorporate that in treatments, but mainly I use it to on people's feet. Well, especially if they have needles in their feet. We also have lightweight space blankets like that they would use you would see for hypothermia or runners. There's really lightweight things that we can put over a patient as well to stay warm. But in the United States, you really want the patient to be comfortable. In China, it's not the same thing, but that's different. Like in this country, we want the patient to be comfortable. We want the patient to be relaxed. Typically, the patient is lying with the needles for about 30 minutes. Could be less, could be more, depending. But it's typically about 30 minutes. And you don't want to be uncomfortable while you're lying there. So we want to make the person as comfortable as possible. Oh, and then that's the vent. So that's the venting system that we were talking about. And let's see, I think that's everything. And we would turn the vent on there, adjust the lights. I have a little light here so I can turn off the overheads. But we've also designed the lighting so that there's no direct lighting on the face, specifically for people who have migraines and headache presentations and photosensitivity. Any questions? All right, cool. Well,